I know I'm on a strict deadline, so I'm going to get started. So I don't have any specific disclosures related to this work, except that I am a respiratory epidemiologist. So I study how the lungs grow and develop, how different exposures across the life course influence the lungs. And so one day I was listening to a podcast where they were telling me about the new emerging epidemic of e-cigarette use, and that led to the work that we are presenting here. So many of you are probably already familiar, e-cigarette use in young people. So these are individuals who have not traditionally used tobacco cigarettes is skyrocketing in the country. And when we talk to people with lived experience, and in this case, particularly young individuals, high school students in the HRM region, they tell us unanimously our numbers are wrong, that everybody is vaping, and that many people don't report their use because in Nova Scotia, at least, it's illegal to use e-cigarettes if you're under the age of 19. So we know that there's underreporting of this problem for sure. So in order to appreciate how we understand why this epidemic has emerged and how e-cigarettes might affect lung health, I thought it was important to go back and look at history and how we got here. So the very first study that has been reported to show the negative effects of tobacco cigarette use was actually published in 1939. One of the reasons for the delayed implementation of this was obviously the Second World War, but we've known for many, many decades that tobacco cigarette use is harmful. And the lungs are particularly resilient to our exposures. So in most instances, and particularly related to tobacco cigarette use, it takes about 20 to 40 years in a lag period before we start to see measurable effects, in this case, lung cancer associated with e-cigarette use. And so we could wait and see how long or what happens to e-cigarette use. But I strongly believe that there are 6 million preventable deaths each year because of our delays in understanding and advocating for the regulation of tobacco cigarette use. And so we need to understand much more rapidly what's happening with e-cigarette use. So I don't want to underestimate the potential harm reduction that e-cigarettes have introduced. So when they were introduced in the formal way that we know them now in the early 2000s, they were designed as a nicotine delivery system that removed the harmful effects. It was designed with good intentions. And there's some evidence from systematic reviews and Cochrane studies that for people who are using e-cigarettes as a smoking cessation tool, that there's marginal evidence of benefit. So for people who use tobacco cigarettes and who want to quit, e-cigarettes provide a useful mechanism to do that. But I'm going to question whether our current numbers and the current epidemic is really centered around this. So when we started looking into this, we were looking at various social media platforms. And what we see is that, at least my opinion, is that these ads aren't targeted at people who are trying to quit tobacco cigarette use. We have lots of mechanisms for cessation tools that are available through pharmacies and are available through different mechanisms. And what we have seen with e-cigarette use is that this is being directly targeted at young people who don't already use tobacco cigarettes. So rather than asking whether vaping is safer than smoking, our team is interested in understanding whether vaping or e-cigarette use is safe. And so what we have measured, not my team, but science has measured, there are about 7,000 flavors that are available. I think the number now is much higher than this. So not only are there the potential harmful effects of aerosolizing the e-liquids, but there's also the the nanoparticles from the coils that are heated that may damage the lungs. And more recent research has shown that the combining of these e-flavors produces even newer chemicals in the lungs that might harm the lungs. And so we've seen through animal and basic science studies that when we apply in a controlled environment e-cigarette exposure to the lungs, that we see inflammation and irritation, destruction of the small airways or the air sacs, and influences to the immune system. And so their colleagues in London have looked at people who have been hospitalized with e-cigarette use lung damage. And what you can see on the bottom is a healthy individual. So if your lungs are working properly, the air disperses throughout your whole lungs. And in the top image and the middle image, you see two individuals who have been hospitalized for e-cigarette use. So we know that there's lung damage from these imaging studies, but Xenon MRI costs about $1,000 per test and is only available in a couple specialized centers. So I'm interested in how the lungs work. So we wanted to see whether there was a point of care physiological test that we could use to detect the effects of e-cigarette use. Most hospitals have spirometry. It's the most commonly used test, but it only measures damage in the large airways. And what we see from the imaging studies and from the basic science studies is that it's the small airways that are affected first. And so we looked at a test called the multiple breath washout to try to determine if there's small airway damage in the lungs. So we wanted to know, is there a difference in lung function and is it dose related? We recruited 18 to 24-year-olds, a healthy control group, as well as those with e-cigarette use. And this is where people with lived experience were really important for our study. Like a good scientist, we had the optimal study design at the start, and then people with lived experience told us all the things that were wrong with our assumptions, and we had to redesign it. And our CRISM funding was actually really useful in helping to expand the study and redesign what we were doing. So spirometry, our first test, measures the large airways, and multiple breath washout measures how efficiently the lungs clear tracer gas and is really sensitive at measuring the small airway damage. We had an equal number of males and females, roughly the same age and body mass index, but I'll just point out we had a disbalance in international students that participated in our study, so a lot of our healthy controls actually came from a very wide and diverse background. We had most people were nicotine users and used flavors, and about half used cannabis in some form, and about a quarter were also tobacco cigarette users. Initially, we tried to only look at people who exclusively use e-cigarettes. These are unicorns that do not exist because most people who start e-cigarettes eventually also use tobacco cigarettes. Most people were daily users and puffed 5 or more times per hour, and on average, this group vaped for about 3 years. When we look at FEV1, so for spirometry, the large airways, we actually see that our exposed group was healthier or had better lung function than our unexposed group. But when we look at lung clearance index, which is that measure of the small airways that we were particularly interested in, we see that our e-cigarette use group had an elevated lung clearance index relative to that unexposed group. And so this is just a visual representation. Obviously, these aren't dramatic differences, but I think in the context of these are young people who should have healthy lungs. These are people who've only, on average, used e-cigarettes for 3 years. We are already starting to see measurable effects in the small airways using these more sensitive tools than what's readily available in the labs. And so what we've been able to show with this study is that using more sensitive tests targeted at the particular area of the lung that is hypothesized to be damaged are potentially a better way of studying the effects of e-cigarette use. We looked at multiple sensitivity analyses, excluding those people who use tobacco cigarettes, excluding those people that use cannabis use, and we get the same signal every time. And although I mentioned my unicorns, we do have the largest group of individuals who exclusively use e-cigarettes compared to any of the other studies in this area. And as I mentioned, people with lived experience really helped us design the questionnaire so that it reflected what was really happening in the community. They told us all the things that were wrong with our study, including the young people who we said, would you like to be participating in a study of e-cigarette use and vaping? They're like, we don't want to know it's bad for us. You have to trick us. You have to tell us that we're doing a study about how healthy our lungs are or how strong our lungs are. If you ask us to participate in a study to look at e-cigarette use, no one's going to sign up. And so I think these are important things to put into consideration when we're designing the next study. I will say the young people highlighted to us how hard this is. So in the course of when we wrote the grant, got the ethics, and started doing the study, all of the devices had changed. So we put pictures of the devices in our questionnaire, and very quickly everyone told us that they were obsolete, and everyone selected other. We wanted to get a better measure of the quantity and what people were using. And again, our people with lived experience quickly informed us that while, yes, you can buy pods and we can measure in those pods what's inside and the concentrations of the different liquids, that's not how people use them. Pods are expensive, so people buy the liquids and they mix them themselves. And so therefore, it's really difficult to know what it is that people are consuming. And alarmingly, it highlights to us that the fact that this is a very unregulated practice where you can mix different liquids, mix different concentrations, most people then don't know what they're actually consuming and what potential effects that has. So while we would have loved to be more rigorous in what and measuring what people were consuming, this was just not possible in the realities of how people use e-cigarette use. And very surprising to us was how many people also use tobacco cigarette use. Again, this is a group of individuals who didn't use tobacco before, and the fact that e-cigarette use was transitioning people to using tobacco cigarettes as well is going to make it incredibly challenging to separate those effects. The reviewers on our paper highlighted this. How do you know that it's not the tobacco cigarette use and it's the cannabis or the e-cigarette use? And so trying to understand how we can find those individuals with enough duration of exposure, but that also haven't started to use dual cigarette use. So I'll conclude because my timer has given me that look. So this study's been, I think, contributing to the evidence in that if we identify a physiological measure that is sensitive at detecting the damage that is hypothesized, we may be able to measure the effects of e-cigarette use much earlier than if we relied on traditional methods. The small measurable dose-dependent effect that we observed highlights that we should be continuing these studies and trying to understand exactly the mechanism behind this damage. But I think this is also important for our public health messaging in that we can't necessarily wait 40 years to find out whether this exposure is negative to young individuals. And the lungs are particularly sensitive in adolescence because that's the final stage of lung growth and development. And so it's potential that this damage that they're being exposed to right now could predispose them to lung disease later on, and it's going to be important to follow them up in the future. So it takes a big team, and I'm very grateful to some of my team members who are here today. And I'd again like to thank CRISM for sponsoring this project and allowing us to really dive deep into these results and into including more people. Thank you very much.
Thank you, Sanja. So we have very, very efficient. So we have some time for questions. Are you going to go over or not? Okay. Sherry?
Hi, thanks very much. I'm just curious, we have at the Fredericton Downtown Clinic a respiratory therapist. We're really lucky. So we do a lot of spirometry, a lot of heavy smokers among our population. I'm just curious, the multiple breath washout, how relevant or how easy is that to have in a clinical primary care setting?
Mm-hmm. So it requires gases. So I didn't get into the details. So the person breathes 100% oxygen, and then while they're breathing 100% oxygen, we see how efficiently they can clear nitrogen from the lungs. So it does require a gas tank in addition to the device itself, but Irene's here, anyone who's done the test itself for the individual is much easier to do than spirometry. So you just breathe normally. Usually we get them to watch a video while they're doing it. So the test itself is easier. It's just the physical device, you need to be in a setting that allows that. We talked about getting a van and driving around. The young people did not want to get into my van to do lung function testing. So we had to rethink that one. But it's more the portable element of it.
I noticed on one of your slides you had that the young people don't want to know the results. And I guess I just wondered first if you could comment a little bit about your experiences with that, but also like how can we use the so important information that you're getting to kind of influence young people's use of vaping? And you know, like that delay of 20 years, you focus on the present, right? And like, just could you comment a little bit about that?
Yeah, so I was really surprised at this because that was one of our, we had actually a consultation session where we presented the results and, okay, so how do we change the language? How do we describe this in a way that's accessible and that kind of would resonate with young people? And that's when they were like, I don't want to we kind of know it's bad for us because they're symptomatic, they can see the changes, they know that they're exercise limited. So almost they have a sense that what they're doing isn't good for them. And one of them suggested to us, well, if you can tell me that vaping now will reduce 5 years of my lifespan or 10 years of my lifespan. And I thought, of all the things I can't do with this research is kind of have that crystal ball to predict what happens. So the other thing that really surprised me is that unlike alcohol use and drinking and driving, or tobacco, cigarette use, where we have really good education programs in the schools, all of the young people we talked to said they didn't hear anything in the schools about the potential negative effects of vaping, or even just kind of the harms of what it means when you combine your liquids and stuff. So we don't have any education happening right now. Lungs Nova Scotia and PEI has a program that they've built in Prince Edward Island, but we don't have that yet anywhere in Nova Scotia, and I think that's a missed opportunity. The other alarming thing is when we talk to high school students, they resoundingly told us it's too late. By the time we get to high school, everybody's doing it. If you have any hope in changing behaviors, you need to get into the junior schools. Anecdotally, we've heard of siblings as young as 9, 10 years old starting to use e-cigarettes. And so to us, it's kind of who we're studying and who the messaging is for is perhaps different. And we need to, in the junior schools where they're talking about tobacco use, or we're introducing some of these health promotion aspects, we need to start talking about vaping then. And we might not have all of the evidence, but I don't think that the evidence of absolute definitive causal proof means that we should wait to start sending some of these messages. And I think we have a lot to learn from people in this room about how we effectively communicate with young people about these potential harms.
Very, very quick. And I just think, also the idea that it's not just like, I think what you're hearing there is education alone isn't enough to change behavior. So that they need that information and they need skills building too.
Yeah. And, one of the things that started this study was a community session with parents and family members of adolescents who were raising the alarm about what they're seeing in the practices. And they kept saying, why isn't Health Canada doing something about this? Why isn't Health Canada doing something about this? And so perhaps we have more of an opportunity to influence policy and regulation of these devices. When you look at the social media, in one of my presentations, I have what Health Canada messaging is, and we just can't compete with the level of marketing and influence, and maybe that's where we have more of an opportunity to change behaviors as well.
That's great. Thank you very much, Sanja.